Ladies and gentlemen, please take your seats. Our program will begin in 1 minute. Ladies and gentlemen, please stand for the national anthem.
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rocket's red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say,
Good afternoon, ladies and gentlemen. Thank you, choir, for a beautiful rendition. My name is Susan Crown, and I am chairman of the Rush University System for Health. Fellow members of the Rush Board of Trustees and the Board of Governors, distinguished guests, faculty members, alumni, students, staff, neighbors, and friends of Rush, welcome to this very special occasion marking the installation of Rush University's fourth president. With a history spanning more than 180 years, Rush has been part of Chicago longer than any other healthcare institution in the city. It all began in 1837 with Rush Medical College, when it was established as the first medical school in the city and one of the earliest in the Midwest. And today, the tradition of outstanding healthcare education, research, and community service that have been with us from the very beginning are stronger and more prevalent than ever. Throughout its entire history, the university has been powered by the passion and the dedication of faculty, students, researchers, residents, and fellows. And as we gather today to install the university's fourth president, that power, enthusiasm, and excellence continues to inspire and propel us forward. As Ralph Waldo Emerson so aptly said, our chief want is someone who will inspire us to be what we know we could be. Inspirational and visionary leaders have long been the driving force behind Rush University, and each in their own way inspired us to be what we knew we could be. Dr. James Campbell, Rush University's first president, made us a more robust and complete health sciences university. He added 2 colleges during his tenure. Dr. Leo Henikoff, Rush University's second president, helped establish and solidify research and excellence at Rush. And Dr. Larry Goodman, the third president of Rush University, expertly brought it all together, growing the university, fully transforming the Rush campus, and securing our place as one of the highest quality academic health systems in the world. Dr. Gabriel, on behalf of the Rush Board of Trustees, I am delighted to be the first to officially welcome you to this presidency and wish you well as you set off to carry the traditions built by those who came before you. I can't wait to see what you will inspire us to be in your new role. It is now my pleasure to introduce and welcome keynote speaker, Dr. Helene Gayle. Dr. Gayle is president and CEO of the Chicago Community Trust, a community foundation dedicated to improving our region through strategic grant-making, civic engagement, and inspiring philanthropy. Before assuming her leadership position at the Trust in October of 2017, Dr. Gayle was CEO of McKinsey's social initiative, now known as McKinsey.org, a nonprofit that built partnerships for social impact. For almost a decade, and where I got to know her best, Dr. Gayle served as president and CEO of CARE, a leading international humanitarian organization. She's an expert on global development, humanitarian and health issues, and spent 20 years with the Centers for Disease Control, working primarily on HIV/AIDS. She also worked at the Bill and Melinda Gates Foundation during their early years, directing programs on HIV/AIDS and other global health issues. This is a woman who likes to go to school. She earned a BA in psychology at Barnard, an MD at the University of Pennsylvania, and an MPH at Johns Hopkins University. She has received 18, yes, 18 honorary degrees, and holds faculty appointments at the University of Washington and Emory University. Her extremely impressive career is inspiring and serves as an outstanding example of a person actively making a difference in this community and in our world. It's my distinct honor and pleasure to introduce our keynote speaker, Dr. Helene Gayle.
Good afternoon. And thank you, Susan, so much for that kind introduction and for inviting me to speak this afternoon. Also, I want to thank you for your many years of friendship and support during our days together at CARE. We really did have a lot of good times. I'd also like to acknowledge the vision and leadership of Dr. Larry Goodman. What an incredible legacy you leave behind. During your tenure, you oversaw the $1 billion renovation of the Rush campus, the formation and expansion of the Rush system, a financial turnaround, national recognition for excellence in patient care, research, community engagement, and technological innovation. And Rush University enrollment more than doubled and expanded its academic programs. Quite a record and quite a legacy. So, with all of that, I think it's clear why it was time to have one person who could focus on the university and medical and health education. And as somebody who has had the privilege of leading organizations, I think one of the most rewarding aspects is knowing that someone is coming after you who can take the organization further than you did and take it in new directions that you never knew were possible. In that, I think Rush has found such a leader. I was fortunate to have a chance to meet and talk with Dr. Shireen Gabriel, to hear her impressive life story, her professional journey, and her aspirations for Rush University. As a clinician, a researcher, an educator, and a seasoned administrator, she is bringing so much to this new role. I was excited to hear her vision of the many ways she wanted to continue to build on excellence and innovation across the medical, nursing, and health sciences and graduate colleges, and continue to integrate the university with the rest of the system. Equally, I was excited to hear about her commitment to health equity and the work that Rush has pioneered in applying the social determinants of health, perhaps most notably in the landmark Westside United program started under Dr. Goodman's leadership. I believe that Rush has the opportunity to be the premier institution in assuring that its students not only have the highest academic caliber as measured by biomedical science and clinical care, but also in understanding and applying an equity lens to its work. I applaud Dr. Gabriel's vision that this is the institution that will be known for training healthcare professionals who recognize that a person's health is about more than what happens in the hospital. Health is what happens throughout our lives. We know that healthcare alone is not sufficient to ensure better health outcomes. Only 10 to 20% of health outcomes are attributable to healthcare. The other 80 to 90% is linked to the social determinants of health, health-related behaviors, socioeconomic and environmental factors. And of course, we know that our genetic makeup can help or hinder as well. I've said many times how excited I was when coming to Chicago a couple of years ago to learn about Westside United. It's one of the largest anchor institutions on the West Side. Rush embraced its responsibility to invest not only in providing care, but investing in the community. Its anchor statement starts by noting that the root causes of many diseases and chronic conditions that shorten the lives of West Side residents link back not to genetics or poor choices, but to social, economic, and environmental factors. We want to address the causes of poor health, not simply treat the symptoms of disease. Why is it so important for Rush to be a leader in pioneering approaches to health equity and addressing the social determinants of health? At least in part, it's because we have such a formidable challenge. Chicago has the largest life expectancy gap in the nation. If you live in a neighborhood like Englewood on the south side, the average life expectancy is 60 years. Or in Lawndale on the west side, it's 63 years. If you live roughly 9 miles away in Streeterville, it dramatically rises to 90 years, 10 years higher than the US national average. Those few miles mean you're 9 times more likely to be killed by a gun, 4 times more likely to die from diabetes, 6 times more likely to be unemployed. In Chicago and so much of the nation, your health outcomes, when and how you will live or die, are determined much more by your zip code than your genetic code. I spent much of my career working in impoverished nations around the world that have better health outcomes than our residents on the south and west sides of Chicago. This is tragic and unacceptable, but sadly, it's not new. In 1966, Dr. Martin Luther King came to Chicago to speak at the second convention of the Medical Committee for Human Rights. At a press conference before his speech, he said, "Of all the forms of inequality, injustice in health is the most shocking and the most inhuman because it often results in physical death." I've heard this cited many times and often misquoted as, of all the forms of inequality, health care is the most shocking and inhumane. Now, I'm not sure if Dr. King himself understood that distinction between health and health care, but it is interesting and instructive that how his words have been interpreted. But we know that Dr. King dedicated his life to alleviating poverty, eradicating racism, and promoting quality education and safe housing, what we now recognize as the social determinants of health. I think he understood then, as we do now, that we need to look beyond healthcare alone. Now, don't get me wrong, I am still a doctor, and I am thrilled by the pace of innovation and new technology that is changing how we treat diseases that used to be death sentences. We have made diseases like HIV and many cancers and chronic manageable illnesses. But I'm still plagued by the fact that our hospitals and clinics are filled with people who shouldn't have to be there to begin with. And that's why the commitment and investment Rush continues to make, not just inside of the walls of its hospitals, but in the community in which it sits, are so, so important. This institution understands that it is not an island and that in order to support and strengthen the lives of the patients it sees, it must invest in the neighborhood. West Side United is an incredible example. Most of you probably know Rush, Sinai, University of Illinois, and Cook County Health System and Amita Health are working in partnership with communities on the West Side. Collectively, they have committed to reducing that life expectancy gap between the West Side communities like Streeterville and the Loop. To do this, Rush and his partners are stepping beyond their traditional roles to providing health services to working in partnership with communities to tackle the root causes of poor health, like unemployment, lack of access to quality education and healthy foods, and unsafe neighborhoods. The arc Rush has taken from providing the highest quality of health care and serving the health care needs of broad ranges of communities to taking on bolder initiatives to address the drivers for poor health and health disparities illustrates an evolution that will improve the lives of individual patients and transform communities. I began my career as a pediatrician, but I soon realized much of what I had to offer was not addressing the root causes of why children I saw presented with illness. I was treating consequences, not causes. So I have spent my life expanding beyond what we do with our medical toolkit to think about the other 80 to 90% of things that affect our lives and our health, our income and assets, our neighborhoods, our food, our safety, our status in life, and our sense of belonging. Thankfully, there are still people who are happy not following my non-traditional career path because we still do need great doctors, great nurses, and great health professionals. And that's why Rush University is so important. But should their time be spent on caring for people who are there because our other systems have failed them? We know that when communities are socially and economically healthy, they have healthier populations. It's all interconnected. As employment and income rises, obesity and heart disease falls. So does alcohol and drug abuse, suicide, depression, and violent crime. That's why I am so proud to be with all of you today to celebrate this pivotal moment in Rush's history, or perhaps better said, her story. Rush has given so much to this city, to our nation, and to our world. Because of the incredible foundation and legacy of Dr. Goodman and the impressive track record and visionary leadership of Dr. Gabriel, I know Rush University will continue to be a pioneer of excellence in medical and allied health education with the understanding that health starts with healthy communities. I couldn't be more excited to watch this next chapter of Rush unfold. So again, thank you so much for inviting me to speak with you today. Thank you, Susan. Kudos to Larry. Congratulations, Shireen, and congratulations to the entire Rush community. Your bold vision is a beacon that will continue to guide West Side, Chicago, and the broader Chicago region and our nation on a course towards health, vitality, and prosperity. Thank you.
It says here, thank you, Dr. Gale, but I'm going to say thank you, Helene. Those were truly inspirational words, and I appreciate your willingness to contribute your voice and your very valuable perspective to this occasion. Your passion for improving the lives of others is admirable and directly aligns with Rush's mission of improving health in our community and in our world. It's now my absolute pleasure to introduce Dr. Thomas A. Deutsch. Dr. Deutsch has served in the position of Provost of Rush University for more than 15 years, 12 of which were concurrent with his role as Dean of Rush Medical College. Under his leadership, the university enjoyed tremendous success, doubling the size of both the research and education missions and with the size of the student body itself. I'd like to welcome Dr. Thomas Deutsch, the James A. Hunter Professor of Rush University, to the podium.
Thank you for that introduction, Susan, and thank you, Dr. Gale, for those inspiring words. As Provost since the beginning of Dr. Gabriel's term as president, I've been honored to have the role of introducing her to the Rush University community. From town halls with faculty and staff to events with students, Dr. Gabriel has immersed herself in learning about the people who make Rush a great place to learn, discover, and thrive. Witnessing Dr. Gabriel embrace the role of leading the remarkable individuals who make up this community and her passion for continuous progress gives me great confidence that her tenure as president will foster a culture of excellence, professionalism, and service in Rush University. For the next part of our program, to show our gratitude and to welcome her as the fourth president of Rush University, several groups representing the university community are here to present Dr. Gabriel with symbolic gifts. Representatives from each group, students, faculty, staff, alumni, and previous presidents will bring their gifts to the stage and share the meaning behind the subject. Finally, the Board of Governors will present Dr. Gabriel with the Presidential Medal, and the chair of the Board of Governors, Carole Segal, will formally introduce Dr. Gabriel as president of Rush University. First, let's welcome our university student representatives to the stage.
Short people always need to adjust the mic first. Okay. Good afternoon, everyone. And on behalf of the students of Rush University, welcome to our presidential inauguration. My name is Ayat Tahlam, fourth-year PhD student in the Graduate College, chair of Student Senate, and serve on the Board of Governors. And joining me today are my fellow Senate leaders. We have Fadi J. Hamati from the Rush Medical College, Melinda King from the College of Nursing, and David Joseph Hughes from the College of Health Sciences. In each college, we have a tradition of giving students a white coat in their first year of school. Dean Bean PhD students would also like white coats, please and thank you. That was not in my script. I hope I don't get yelled at. This ceremony is more than just a rite of passage, right? It symbolically introduces the student to their first step in their professional medical career. And receiving this coat offers more than just an opportunity to consider the expectations that are symbolized by the coat, but it prepares you to embark on a journey that you are about to take for the rest of your life. And as students, we know that life isn't about waiting for the storm to pass. It's about learning to dance in the rain. And although Dr. Gabriel has been with us for only a short period of time, she's taught us how to jam in that rain. And to reflect the tradition of the white coat ceremonies, Dr. Gabriel, on behalf of the students of Rush University, we are pleased to present you with a white coat adorned with a really cute gold university pin. We're proud to have you join our university. We are excited to see what steps we have to come and where we see you envisioning for our school's future, what we see you envisioning for our school's future. Thank you so much, Dr. Gabriel.
I'm Ed Barker, professor at Rush University. Joining me is my colleague Sue Swider, who is a professor in the College of Nursing, Dr. Nick Moore, assistant professor in the College of Health Sciences, and Dr. Tom Schmid, who's associate professor in the Rush Medical College and the Graduate College. When we're all representing the excellent faculty at Rush University. And on behalf of Rush University faculty, we present to you, Dr. Gabriel, a plaque engraved with a summary of the practitioner-teacher model. The underscoring concepts of the model is to integrate patient care, education, and research. And it's in keeping with the interdisciplinary approach that are integral to the modern care delivery. And in other words, here at Rush, our faculty practice what they teach for the benefit of the student and patient alike. And we hope you keep this somewhere inside of your workspace as inspiration and a reminder of Rush University's commitment to this philosophy. So, thank you.
I'm Chet Brower, Chief of Staff to Dr. Gabriel, and joining me is Capella Petalinghogue, Director of Administrative Operations and Division of Student Affairs. Every one of the more than 400 staff members at Rush University are an integral part of this institution, from supporting research and instructional design to providing technology assistance in classrooms and advising students through financial, academic, and personal challenges. Every member of staff contributes to the success of our students and the excellent reputation of our university. Dr. Gabriel, on behalf of the staff of Rush University, we present you with this framed aerial photo of the Rush University campus as a representation of the wide-reaching role our staff play in making this campus a vibrant and thriving environment to learn, discover, and thrive. We're looking forward to your valuable contributions as a leader of this campus.
Good afternoon. My name is Dr. Fred Brown, alumnus of the College of Nursing. Joining me is Dr. Chris Coogan, Dr. Laura Vasquez, alumna of the College of Health Sciences. Dr. Coogan is with the College of Medicine. And then also Dr. Jenny Wallace, alumna of the Graduate College. As alumni, we have fond memories of Rush University and our individual journeys of transitioning from students in the classrooms to professionals and experts working across diverse fields in healthcare and science. What bonds us is our commitment to the highest quality of patient care, which we learn at Rush University. Dr. Gabriel, on behalf of the Rush alumni, as a symbol of our shared history, we present to you with Good Medicine, a story of generations of dedicated health professionals who shaped Rush to become one of the nation's leading academic health centers. We're excited to share and to make our own memories with you and hope you find inspiration and guidance in this story as well. Thank you.
Good afternoon, everyone. I'm Larry Goodman. I'm the immediate past president of Rush University, and it's certainly a huge pleasure for me to be here today. And the gift I've got for you is the key to the sessions home of Rush University. Truth in advertising is not the actual key. But it does represent something more symbolically than just the house. The house is made possible by a gift of somebody who worked at the Rush in the past, who is an employee and an inventor, Robert Sessions. And it is not only the home of the president of Rush University. It represents the home of the university, and not just the president. It is an opportunity for you as the president to take advantage of seeing people in a more social setting, that is our students, our faculty, our staff, our alumni, our board members, and put your own stamp on the three most vital things about the university. The university as a community of itself, the culture of the university, and the university's sense of family. Now, often at inauguration, it is sort of like what might be, but we all know that you've already done that in the 9+ months you've lived at the Sessions home, and you've done a wonderful job of extending these three important things. On an even more personal note, Meek and I are thrilled to see you take over this wonderful resource with Frank. Congratulations.
Good afternoon. On behalf of the Board of Governors of Rush University, we thank you all for joining us today. First, it's my great honor to introduce Carole Segal, the Chairman of the Rush University Board of Governors. And I'm Bob Wislow, Vice Chairman of Rush University. What Vice Chairman means is that both Carole and Dr. Gabriel are my bosses. So I better not screw up today. Carole and I are honored to be a part of this very special day for both Rush University and Dr. Gabriel. As members of the Presidential Search Committee, our dream was to find an extraordinary and visionary leader. We couldn't imagine a more perfect fit for that job than Dr. Gabriel. It's unbelievably gratifying for us to have the honor of formally introducing Dr. Gabriel to the Rush family and to present her with the first ever Rush Presidential Medal. As tradition dating back to the Middle Ages, chains of office are solid metal necklaces worn by university presidents on ceremonial occasions. The President's Medal is an integral part of the university's presidential regalia, symbolizing the wearer's authority, responsibility, and commitment to their university community. This symbol is deeply embedded in the history of many universities worldwide, and today's inauguration of Dr. Gabriel introduces this tradition for the first time at Rush University. The medal is comprised of gold links bearing the names of the tenures of our 3 past Rush University presidents, and the chain is anchored by a large medallion cast in gold and depicting the Rush University seal. Carole, medallion, please.
Well, I want to thank everybody for being with us today. It's a very, very special day for Rush University. So much has gone into getting us to this monumental day, and I am grateful and appreciative to every single person who has contributed and supported our efforts along this journey. As Bob mentioned, during the search that ultimately brought us Dr. Gabriel, we scored the entire country for the right person to lead this excellent university. We knew after several interviews that Dr. Gabriel was the right person for the position of president of Rush University. After getting to know her and working closely together over the past few months of her tenure here at Rush, I can say with absolute confidence that our instincts were right. Rush University is extremely lucky to have found this exceptional person to lead us into the future, and I'm pleased to be here today to introduce her. Prior to joining Rush, Dr. Gabriel was the Dean of Rutgers Robert Wood Johnson Medical School and CEO of the Robert Wood Johnson Medical Group, as well as a distinguished professor of medicine. Dr. Gabriel completed her residency, followed by a fellowship in rheumatology at Mayo Clinic, and continued there as a physician, researcher, educator, and leader for nearly 30 years, culminating in her appointment as Dean of Mayo Clinic College of Medicine in 2012. Dr. Gabriel completed her undergraduate education at the University of Regina in Saskatchewan, Canada, and the College of Pharmacy at the University of Saskatchewan Medical School before earning her medical degree at the University of Saskatchewan College of Medicine. She received her master's degree in clinical epidemiology from McMaster University in Hamilton, Ontario, and completed additional study at the Wharton School at the University of Pennsylvania and the Kellogg School of Management at Northwestern University. As you can see, she is supremely qualified for this position and has already hit the ground running as the 4th president of Rush University. It is my honor and my pleasure to introduce you to Dr. Shireen Gabriel.
Wow. Okay. Well, it is just wonderful to see all of you here. I just couldn't be happier to have you with us today. As many of you know, Carole Segal is a very special person. She is a successful entrepreneur in the retail industry, one of the most influential businesswomen in Chicago and beyond. She's a volunteer, she's a philanthropist, and as trustee of Rush University Medical Center and chair of the Board of Governors of the university, her wise counsel has been invaluable, especially during this time of change. Carole, ever since I met you during the interview process, rigorous as it was, I've been struck by your keen intellect, your poise, your judgment, but especially by the compassionate, kind, and caring way you do everything you do. I've been truly privileged to work with you and to learn from you. Thank you, Carole, for your leadership and for that very kind introduction. Thank you. I'd also like to thank Bob Wislow for his role as Vice Chair of the Board of Governors. He was just kidding. They're both my bosses. Your leadership and insights, Bob, will shape the university's future. I feel truly blessed to have both you and Carole as my guides on this journey. And thank you, Susan, for your exemplary dedication to all things Rush and for opening this historic event. Your long and deep commitment to Rush helped make us what we are today. And now, with you at the helm of the Board of Trustees, we look forward to an even brighter future. Dr. Helene Gayle, you're an inspiration to all of us. Your career exemplifies how a single, brilliant, committed, and I'll say fearless woman can make a difference with overwhelming problems like global poverty and HIV/AIDS. So take note, all you students out there and maybe listening to us streaming, not screaming. And thank you, Helene. Tom Deutsch, you did a wonderful job. Yes, let's do that. Tom Deutsch, you did a wonderful job, as always, emceeing the presentation of the gifts. But I have to say that I'm most grateful for the gift of working with you these past few months. I'd now like to recognize all other members of the platform party you see here. Our amazing deans, Drs. Andrew Bean, Mark Foreman, Jason Turner, here for Dean Royin, and Dino Romero. Our remarkable vice provosts, Gail Ward, Drs. Susan Chubinskaya, Josh Jacobs, Rose Suhaida, and David Katz. Our brand new provost, Dr. Susan Freeman. Our CEOs and my incredible partners, Dr. Omar Latif, CEO of Rush University Medical Center, and Dr. Ranga Krishnan, CEO of the Rush University System for Health, and my very dear mentor, who traveled here from Canada, Dr. Claire Bombardier. We'll clap for them all at once. A very special thank you to Dr. Larry Goodman for leading the procession today as Marshal. Nothing could be more fitting. It was Larry's visionary and transformational leadership that has placed Rush on the trajectory of success that we see today. Larry, we all owe you a deep debt of gratitude. Thank you. On a personal note, I am grateful for the incredible support I received along the way, first and foremost from my family. My husband, Frank, in the second row there, could not possibly have been more supportive of me throughout my entire career. Frank, your love and support is the foundation of everything I do and everything I am. Thank you. I'm also immensely grateful to my parents, Huda and Aizet, who are still with me but can't be here, who have put my interests above theirs my entire life. From their decision to immigrate from Egypt to bring us a better future in America, to their decision to move from Canada to Rochester, Minnesota to help us raise our boys. And to my two sons, Richard and Matthew, who I hope are watching, who are a constant source of joy, happiness, and pride in my life. Thank you guys for being just plain wonderful and for remaining near me no matter how far away you may be. I'd also like to recognize members of my Mayo Clinic family sitting kind of over there who are here today with us, waving. Dr. Cindy Croson, Terry Rummans, Carl Redding, and Naveen Pereira. I know I have a couple of dear friends from Rutgers in New Jersey who made the trip, Dr. Keith Lewis and Mr. Fernando Oliveira, and my good friend from New York, Dr. Peggy Crow. Thank you for coming. And I believe I also have my new but dear friend from Rwanda, Dr. Agnes Binagwahu, here today, Vice Chancellor of the University of Global Health Equity and former Health Minister of Rwanda. Thank you guys all for making this trip. And lastly, my thanks to all of my Rush colleagues who are here today and streaming to celebrate this day with us. A university is defined not by its physical structures, but by its people. To me, you are Rush University. Chairs and members of the Board of Governors, chair and members of the Board of Trustees, faculty, staff, alumni, friends, and family. I am honored and humbled to stand before you today as the 4th president of Rush University and the first fully dedicated to this great institution. I follow a tradition, as you've heard a little bit already, of bold and transformational leadership, which for this university began with its first president, Dr. James A. Campbell, who created a true health sciences university with the founding of the College of Health Sciences and the Graduate College. Next, Dr. Leo M. Henikoff led a great period of expansion, particularly in research, with the construction of the Robert H. and Terry Cohn Research Building, still the home for basic science research at Rush. And of course, Larry Goodman, who led Rush for 17 years. Under his leadership, student enrollment grew to more than 2,500. He built partnerships with Chicago high schools and colleges. He championed Rush's anchor mission and our goals to increase the life expectancy of our West Side neighbors and more. Under his guidance, Rush University Medical Center grew into the Rush University System for Health. We added Rush Copley Medical Center, we strengthened the integration with Rush Oak Park Hospital, and we added outpatient locations across Chicago and the suburbs. At the main campus, Larry led the construction of the absolutely stunning new hospital tower and early planning for the Joan and Paul Rubschlager Building for Cancer and Neurosciences. And I'm grateful that Joan and Paul Rubschlager are here with us today. Larry's legacy at Rush and across our community will continue to impact many lives for many years to come. Thank you. Today is a celebration for Rush University. We're a nationally recognized leader in health education, innovative research, and patient care. Our education and research programs are consistently ranked among the best anywhere. And Rush University Medical Center was just 2 weeks ago ranked #1 for quality of care in the nation. Sorry, we even beat out Mayo, so. This remarkable success is occurring against the backdrop of a failing healthcare system in America, where healthcare expenditures are twice as much per capita than in much of the developed world, yet health outcomes are far worse. where workforce shortages in the health professions loom large even as the population ages, and where health inequity is growing at an alarming rate. In fact, right here in Chicago, residents of the West Side, as you've heard a little bit, our neighbors, have a life expectancy that is a full 16 years shorter than residents just a few neighborhoods away. I think Dr. Gale said 9 miles. Perhaps not surprisingly then, Rush's success has somewhat baffled the biomedical community. In fact, during my recruitment period, Rush was once described to me by outsiders as an enigma shrouded in mystery. How can an institution enjoy such success in the face of these overwhelming challenges? Since coming to Rush, I've begun to understand. Rush is not simply an institution, it is a philosophy, a shared vision, a belief that by working together, we can bring about meaningful, positive change in people's lives. At Rush, we understand that transforming healthcare is not just about better healthcare. It is about better health for all of us. At Rush, we understand that to improve the health of the population, we must have an authentic commitment to community and to ending health inequities. That means education programs, research programs, clinical programs, and community programs all pointed in the same direction, improving health. These are the hallmarks of the Rush tradition. Medical institutions are about providing the best care to every patient every day. Universities are about building a better future. Rush University, a pure health sciences university that is fully integrated within a thriving health system of the highest quality, is uniquely positioned to build a better future for healthcare and for a healthier world. Our plan for Rush University as a catalyst for change centers around 3 pillars, which you've already heard about. Learn, discover, and thrive. The first pillar is learn. We will educate the next generation of healthcare leaders and build a unique health sciences and health professional learning community. With innovative interprofessional education, we'll help prepare the next generation to address the future healthcare needs of Americans and to contribute to the transformation of American healthcare. Our second pillar is discover. At Rush, we will advance knowledge to improve health. We will discover and disseminate new knowledge through collaborative research and leadership in the health sciences, health delivery, and health policy. We will emphasize biomedical sciences and also quality of care, community health equity, and population health. And will leverage Rush's strong tradition of service and social responsibility together with our deep expertise in health analytics. Our third pillar is thrive. At Rush, we are a family, and we value every family member. We are more dedicated than ever to creating an environment where all members of our family thrive. We'll focus on innovative wellness, engagement, communication, mentoring programs, diversity and inclusion. Our guiding principles are the Rush I-CARE values of innovation, collaboration, accountability, respect, and excellence. This plan and these principles are what differentiates Rush University and what positions us to be a catalyst for healthcare transformation. I accepted the role of Rush University president because I was impressed by the work being done here, by the tradition of quality and leadership, and by the trajectory of the institution. Since coming to Rush, what I've been most impressed by is you. Your commitment to solving these great challenges in healthcare and your belief that we are much stronger and more successful when we work together. We're going to keep doing more of that. As president, I'm committed to fostering a culture that empowers all of us to learn, discover, and thrive. I couldn't be more excited to serve as your president and to help build that future with all of you. Thank you, and good evening.
Wow. Yes. Thank you, Dr. Gabriel, for those moving and inspiring comments. Yes. Yes. No university is better positioned to address the issues we will face as a nation than Rush University. We are fully integrated within a leading academic health system and one of the only of very few U.S. universities solely focused on health sciences. And with Dr. Shireen Gabriel leading the way, there's no question in my mind, and I hope after you all have heard her speak, that Rush University will create, model, and deliver innovative solutions to old problems. We will face the challenges of the future as opportunities for change. Those are Shireen's words. She keeps on saying it's an opportunity. We fully realize the amazing potential that every one of us today sees in Rush to make a difference in healthcare education. Congratulations, Shireen, to you, your family, far distance away, the sons that are listening to us today on this remarkable day. Welcome to Rush University, President Gabriel. I speak on behalf of the Rush University System for Health when I wish you the absolute best in your tenure as the 4th president of Rush University.